Assalamualaikum dear students, this is week 14 and I Dr. Tamkeen Saleem welcome you to the lecture on topic obesity and eating disorders. The learning objectives include that students will be able to learn what are the approaches to lose weight, what are the eating disorders, what is anorexia nervosa and how it can be treated. Usually those who want to lose weight, they want to carry that out in a very short span of time, due to which they often take drastic measures to lose weight. And there are sometimes many physicians who recommend drastic measures for uh, losing weight, specifically for the obese patients. Even with the medical supervision and some weight reduction programs present risk, sometimes to the point of being life-threatening. There has been one approach that turned out to carry substantial risk was to take drugs to reduce the appetite. In 1950s and 60s, there was usage of amphetamines in order to decrease the weight. These were considered as diet pills and they were prescribed by the medical practitioners to increase the activity of the nervous system, speed up metabolism, and suppress the appetite. However, this drug has a dependence, and this dependence may become a more serious problem in comparison to obesity. So, we consider that it is a very dangerous way to lose weight. Similarly, there have been other techniques in which methods in which you may have seen British Slimming Center. What they do is that they provide specific kind of powders which are taken by the people, which form some kind of keva or some kind of drink, or you can say a juice kind of thing, and people are asked to drink it for 3 months and not to eat anything else. So, generally, people tend to lose weight very quickly in the earlier days. However, then it becomes problematic, and it has been seen that a number of people have reported different kind of development of tumors as well as other health issues. Fasting is another weight loss approach that is used, but that can be very much dangerous because the people are kept deprived of food, which tend to lose stores of carbohydrate stored as glycogen along with the water that is stored with it after the weight loss. And this what happens is that people begin to metabolize the stored fat and muscle tissue about equally. And this drastic um, cut in the food intake actually it leads to a health threat to the internal organs because the muscle tissues are being used as well. Another approach is the surgical procedures, which is again a drastic method of losing weight. There are different types of surgeries that may have an influence onto the weight. There have been a specific surgery that is becoming more and more common even in Pakistan, which is known as um, in which what is done is that stomach is basically uh, cut down into a smaller part, or some part of the intestines are basically um, rounded off, or what we can say is that stomach is actually squeezed through the surgery. Gastrectomy is the term that is used for it. And what happens is that in Pakistan, because of the reason that the surgical procedures are not good, or sometimes we just see that people tend to have more and more problems. Sometimes the surgery goes out of control, or they tend to stitch it more tightly, due to which people again have difficulties in eating. So the point is that uh, appetite is there, but people are not, or the urge is there, but the people are not able to eat more because the capacity of the stomach has been shrunk through the surgery. Another technique which you might be aware about, you may have seen the billboards in Rawalpindi, Islamabad regarding liposuction. It is an approach which is surgical, in which there is removal of adipose tissue through a fat suctioning technique. The technique produces a recontouring of the body rather than an overall weight loss. This procedure is not useful in controlling obesity, rather, we consider it to be a cosmetic procedure to change the body shape. It has a little impact on the obesity, rather, it just changes the body. Similarly, there are other surgical procedures like tummy tuck, in which again there is recontouring of the body through the surgical procedures. These drastic methods are actually poor solutions for obesity for the people. An eating disorder is serious and habitual disturbance in eating behavior that produces unhealthy consequences. Definition of eating disorder excludes starvation resulting from inability to find suitable food supplies and also unhealthy eating resulting from inadequate information about nutrition. It also excludes um, all the disturbances that occur in eating behavior, for example, pica or eating of non-nutritive substances. For example, people tend to eat hair or plastic or wood, sometimes tube lights, or rumination disorder of infancy. That is actually regurgitation of food without nausea or gastrointestinal illness. Anorexia nervosa. Anorexia means lack of appetite due to a nervous or psychological condition, which means that it's an eating disorder in which there is intentional starvation and distorted body image. People with anorexia do not have a loss of appetite, as the name or the terminology of anorexia nervosa indicates. Ordinarily, they are perpetually hungry, but they insist that do not have a desire to eat or they do not want to eat. William Gull, in 1874, he regarded condition of self-starvation as a psychological disorder, and he was the one who termed the um, disorder as anorexia nervosa. However, there were two cases that were documented by Richard Morton in 1689. There was an 18-year-old girl who had died of effects of anorexia, and an 18-year-old boy who had actually survived. They both had shown a remarkable indifference to starvation, and both had been described as sad and anxious. In around 1940s and 50s, the psychiatrists, having the psychoanalytic view, they considered that a denial of femininity and fear of motherhood was actually the cause of development of anorexia nervosa. Unfortunately, it was this hypothesis was not considered to be helpful in expanding the scientific understanding of anorexia nervosa. However, there have been a shift from these different distorted speculation, and it is considered to be a socio-cultural, family, and biological um, disorder. Recent emphasis has been on describing the disorder in terms of behavior and their physiological effects, demographic correlates, and effective treatment procedures. DSM defines anorexia nervosa as intentional weight loss to a point that the person has a body mass of 17.5 or less, along with the fear of being fat, a distorted body image, and for women, amenorrhea, the cessation of menstrual period for at least 3 cycles. Two types of anorexia nervosa: restricting type, in which people usually do not eat anything at all, losing weight by dieting, fasting, exercising, or combination of all these. The second one is binge purge type, in which people eat large quantities of food and use vomiting or laxatives to purge the food that they have eaten. These anorexic may eat small amounts of food and purge. Purging is also present in bulimia and binge eating. But bulimics purge to maintain normal body weight, anorexic purge to lose weight. Who is anorexic? It is not a disorder that is common to a particular culture or a particular ethnic group. It runs across all cultures and all ethnic groups. It is more common in upper middle class. Slightly, it's more common among the females, specifically those having better access to health care. It is more uh, getting prevalent day by day in comparison to 50 years ago, and the estimated lifetime prevalence of anorexia is zero point 0.5 for women and 1/10 of that for men, which shows that it is more common among women. The competitive weight conscious atmosphere of various professions, as well as something that is portrayed in media, that tend to indicate that people actually develop anorexia nervosa. For example, there is a requirement in dancing schools and modeling profession, as well as among the athletes and cheerleaders, that they need to have a specific kind of body that is thinner. So these people tend to have more and more development of anorexia nervosa. It has also been seen that people with anorexia often have family difficulties, which leads to eating problems. There are also negative emotions and little emotional support available to them. There is often reports of family violence. Male anorexics are quite similar to female anorexic in terms of social class and family configuration, symptoms, treatment, and prognosis, but they differ in terms of factors that push them towards disordered eating. They tend to take drastic measures to achieve their body ideals, just like women. And the ideal body for the boys is muscular, and escaping this indoctrination is as difficult as avoiding the thin ideal body for the girls. Anorexia has highest mortality rate. People die of cardiac arrhythmia. Suicide is also very common. Despite the very real possibility of death, anorexia nervosa remains one of the most difficult behavior disorder to treat. About 75% of anorexic recover, and those who do not tend to recover, they keep struggling from eating related body image problems. Between 9 to 18% continue to exhibit symptoms of anorexia, even those who are treated. The treatment is difficult because they continue to see themselves as fat and they have a lack of motivation to change their eating habits. Anorexic need to work towards the restoration of normal weight, healthy eating, and improved body image, which they do not see that there is any need. However, we can make utilization of motivational interviewing to change their attitudes about the problem and make people more willing to work. Psychological treatments can be effective, like CBT. Drugs are often used for the treatment of anorexia.